Welcome to the Genodyne Wound Dressing Training. This program will demonstrate how to prepare a wound site for therapy using the Genodyne Wound Care Dressing System. The Genodyne Wound Dressing Kits come complete with the following: a specific size of green foam, transparent films, and a port dressing. The size of the dressing kit selected should be based on the size of the wound that is being dressed. The green foam is non-adherent, highly porous, and openly reticulated to allow for improved hydrolytic stability. This non-adherent property reduces pain and discomfort during dressing application and removal. It also reduces the risk of trauma to the wound. The unique cell structure also increases tensile strength, thereby reducing the risk of fraying or infection. And lastly, the color contrast of the foam increases differentiation within the wound bed. Scissor lines are located on the transparent adhesive, ensuring a correct cut when matching the wound to the film size. Dressing application. Before starting negative pressure therapy, confirm the physician's order and assemble the needed supplies. This includes the dressing kit, the negative pressure wound pump, and the collection canister. First, cleanse the wound with normal saline or per facility protocol. Second, apply skin prop to the peri-wound area and let dry. As an option, transparent film may be applied to protect the peri-wound area using a window pane method. To accomplish this, cut a strip of transparent adhesive dressing and place on the wound edge with the numbers 1 and 2 sides down. Trace the wound edge and trim adhesive dressing accordingly. After trimming, lay the dressing pieces down, taking care not to overlap the adhesive dressing strips, and remove the tabs. Repeat this process around the entire wound edge, leaving a 1 to 2 cm beyond the edge. Note, as an optional step when using foam, the clinician may choose to cut a piece of non-adherent dressing not included in the kit to fit any area over bone, tendon, and/or ligament, placing the foam into the wound bed. Now cut the foam to match the size of the wound. Do not cut the foam over the wound bed. Place the foam in the wound bed, ensuring it fills the entire space. As a guide, the foam should extend approximately 2 cm above the wound edge. Remember to note if any additional pieces of foam were used to pack the wound. Finally, apply the transparent dressing, leaving at least 2 to 3 cm beyond the skin edge. Choose a port dressing site and cut a quarter-size opening in the transparent film. Remove the number 1 backing from the port dressing and place over the opening on the transparent film that you just created. Remove the number 2 backing and lastly, remove the side tabs. It is important to position the port dressing plastic applicator over the opening in the transparent film, directly over the green foam, ensuring that the edge of the port pad is not touching the peri-wound or skin. Attach the lower lock connection tubing to the port dressing. Ensure all clamps are open. Turn the pump on and observe the ease in the drawdown. Gently run your fingers around the edges to ensure the seal is secure. Remember not to apply the port dressing over a pressure area. A bridging or relocation technique can be used in these situations. If bridging or relocation is required, select the area for the bridge and cut a piece of foam, ensuring the length will be sufficient to cover the area being bridged. Use skin prep to the skin edge and let dry. Then apply the transparent film over the area. Run a piece of bridge foam from the main wound bed and apply the transparent film over the entire bridge. At the end point, cut your port site and apply the port dressing. We offer the versatility of providing a microbial gauze application or green foam dressing application using a port dressing. Genadyne provides 24-hour, 7-day-a-week clinical support.